Hello! In today's video, I will be talking about the use of the UNC 12 probe. This probe has a handle, a shank, and a thin round working end. The working end and the shank meet in a defined angle that is usually greater than 90 degrees. It is used to measure and record probing depths up to 12 millimeters, and it has markings at each millimeter and black color bands between 4 and 5 millimeters and 9 and 10 millimeters. Its primary function is to detect periodontal pockets and to assess the health of the periodontium. It is also used to measure clinical attachment loss, measure extent of recession of the gingival margin, measure the size of intraoral lesions, assess bleeding on probing, and to measure the width of the attached gingiva. Some contraindications are sites of abscess, pus, newly eruptive teeth, and titanium implants. When using this instrument, the modified pen grasp method should be used, having your index and thumb fingers on the instrument handle forming a soft C. The middle finger rests lightly against the shank. The ring finger is your fulcrum finger and is placed on a tooth surface, often in incisal or occlusal surface of a tooth, and the little finger has no function. Clinical attachment loss is the distance between the CEJ and the junctional epithelium. The depth of the periodontal pocket is determined by measuring the distance of the gingival margin to the base of the sulcus. We need to record measurements of 6 zones per tooth: the distofacial, the facial, the mesiofacial, the distolingual, the lingual, and the mesiolingual. This means that when you do the recording of the 6 zones of your tooth, you're going to start first at the distal facial line angle to the midline of the distal surface, and you're going to record your deepest measurement. And then you're going to start again at the distal line angle all the way to the mesial line angle, and you're going to record your deepest finding for the facial surface. And then you're going to start again at the mesiofacial line angle to the midline of mesial surface, and you're going to record your deepest finding. And then you're going to start at the distal lingual line angle to the midline of the distal surface and record your deepest measurement. And again, for the lingual surface, from the distal lingual line angle to the mesiolingual line angle. And then again, you will do mesiolingual line angle to the midline of mesial surface and record your deepest finding. So only the deepest reading is recorded, and when we start to take our measurements, we start from tooth number 1 to tooth number 16 facial, and then we go from tooth number 16 to tooth number 1 palatal, and then we go down from for tooth number 32 to number 17 buccal, and then 17 to number 32 lingual. So we start at the distal line angle. We go to the bottom of the sulcus. We push very lightly until we see blanching of the GE. Once the probe is inserted into the periodontal pocket, the working end is kept parallel to the root surface, meaning that the tip should be flat against the root surface. We walk the probe to the interproximal surface until we reach the contact area of the adjacent tooth. And then once we reach the contact area, we are going to tilt our working end about 10 degrees to measure the distance into the cold space. And we record our deepest measurement. And then we remove our instrument, and then to measure the facial, we start at the distal line angle. Note that this is the only time we are allowed to remove our probe from the gingiva. So we start at the distal line angle. We insert our instrument, keeping it parallel to the long axis of the tooth. We do our walking strokes towards the mesial line angle, and we record our deepest measurement. Remember that to adapt our instrument, our probe should be kept in contact with the tooth surface, and for correct angulation, the probe is positioned parallel to the long axis of the tooth. So once we are in the mesial line angle, we're going to do our walking strokes into the until we reach the contact area of the adjacent tooth. And then once we reach the contact area, we're going to tilt our working end about 10 degrees into the cold space, and then we record our deepest measurement. So if you want to do the lingual surface of sextant number 4, you will start again at the distal line angle, and then you will insert until you see blanching, and then you will do your walking strokes until you reach the contact area of the adjacent tooth. Once you're at the contact area, you will tilt your instrument about 10 degrees into the cold space, and then you record your deepest measurement. So you will remove your instrument. You start again at the distal line angle, making sure that your the tip of your working end is towards the tooth surface, and then you insert, and then you do your walking strokes until you reach the mesial line angle, and then you record your deepest finding, and then you will go and then you will tilt until the cold space if there was a tooth next to it. And then if you want to do the maxillary, let's say here for quadrant number 1, you will do the same thing. You start always at the distal line angle, and then you will do your you always want to make sure that the tip is towards the root surface, and then you will do your walking strokes until you reach the contact area. You tilt your instrument into the cold space, and then you record your measurement. You start again at the distal line angle. You do walking strokes until you reach the mesial line angle. You record your measurement, and then you will do the same. Go again into the contact area, tilt your instrument into the cold space, and record your measurement, sorry. For anterior teeth, we start at the distal facial line angle. So we insert our probe at the distal line angle. We tilt the probe so that the tip of is always pointing towards the root, and we walk our instrument towards the mesial, towards the interproximal area. Once we reach the contact area, we will do again, tilt our instrument 10 degrees into the cold space, and then again we remove. We start at the distal line angle, and then we go to the mesial line angle and record our finding, and then do the same mesial line angle into contact area, and then tilt 10 degrees into cold space, and then record our finding. And that's about it.